Good morning, everyone. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing, our weekly briefing for Tuesday, September the 21st. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. Today we're providing an update on the COVID-19 pandemic in British Columbia. And with that, it's my honor to introduce Dr. Bonnie Henry.
Good morning and thank you. Today I would like to provide a few updates on the vaccine program and some of the issues that have come up around immunization, as well as some updates on our ongoing public health response to the pandemic. First, as many people know, the COVID-19 vaccines in Canada that were originally approved for emergency use to ensure we could get vaccines as quickly as possible. Well, as of last week, on the 16th, both the Pfizer and Moderna messenger RNA vaccines and the AstraZeneca vaccine have now been fully licensed for use in Canada. So that is technicality in many ways, but it is important to know that all of the important safety checks have been continued and that these vaccines have now checked all of the official compliance requirements for ongoing use in Canada. One of the challenges that comes with that is that the companies are now able to use their brand names rather than just as we've been referring to them by the company names or by the technical names. So the new brand names, as you may be hearing about now, are Comirnaty, Spikevax, and Vaxzevria. And as you can tell, these are not easy ones to pronounce. And so I think, like many people, we'll continue to call them by what we've known them now for at least a year, which is by the Pfizer and Moderna. But just so that people are aware that they're not new vaccines, these are just the new brand names by the different companies. One of the things that has come up as well more recently is concerns that people have had about receiving vaccination if you're planning to get pregnant or if you're pregnant or breastfeeding. As we know, COVID-19 doesn't discriminate, and sadly we are seeing hundreds of new cases every day, the majority of whom, as you know, are people who are not yet vaccinated. And these are young adults, parents, new mothers, elders, and seniors requiring hospitalizations and in some cases ICU care. And I know from the visits that I've made to healthcare facilities and our ICUs around the province that we have a number of young women pregnant who are in ICU right now who are not vaccinated. We have seen this happen particularly since May, once we started to see Delta transmitting more easily, and we've seen the tragic outcomes of that across the province. So I'd like to take a moment to specifically speak to the importance of vaccination in pregnancy, while breastfeeding, or if you're planning to get pregnant. We know that this is a particular concern. We want to take as much care as possible when we're pregnant, and I know there's a lot of questions that people have. So it is important to get that information, to understand both the safety profile, the concerns that we know about the vaccines, but also to understand the risk of COVID in pregnancy. I encourage people to go to the BC CDC website where there's some very specific information about the vaccines, about the data. And while it is true that the clinical trials did not include pregnant people, we also know a lot more about these vaccines and how safe and how they work in people who are pregnant, in breastfeeding people over the last year, where tens of thousands of pregnant and breastfeeding people have been immunized. First, I want to say unequivocally, it's been recommended by the Society of Obstetricians and Gynecologists here in Canada, by our National Advisory Committee on Immunization, and by similar groups around the world. All of the vaccines that are approved for use in Canada are not only safe, but recommended for people who are pregnant, people who are thinking of getting pregnant, and people who are breastfeeding. We are very fortunate in BC that we have one of Canada's leading experts here, Dr. Deborah Money, and Dr. Money is the lead researcher on a BC and Canadian study on COVID-19 in pregnancy, and has been, as part of that study, is looking at the use of vaccines in pregnancy. Her work to date is very reassuring, and this will be coming out and being published. We've seen some information already from Ontario that's part of this, but it has shown there is no increased risk of complications after being immunized to you or to your baby. There are no differences in miscarriage, preterm births, stillbirths, or birth defects, and international data supports this as well. Over 90,000 pregnant women have been vaccinated against COVID-19 in the United States, and a study very recently came out looking at outcomes, and no major side effects have been identified. And importantly, safety data shows that pregnant people have the same, mostly mild, side effects as everyone else, and there were no increased risks of pregnancy complications or neonatal outcomes when you're vaccinated. But we do know that there is an increased risk of severe illness requiring hospitalization or ICU care if you get COVID-19 when you're pregnant. Canadian data, including about 1,500 pregnant people here in British Columbia, and international data show that significantly worse levels of severe disease, especially now with the Delta variant that we're seeing, and higher rates of adverse infant outcomes, things like stillbirths and preterm births, or babies being born early. In fact, knowing this here in BC and across Canada, we prioritize people who are pregnant for early access to vaccines, knowing that this risk can be averted by protecting people through immunization. In other words, it is highly recommended that pregnant women get their vaccine as soon as possible, preferably if you're planning on getting pregnant to have the vaccine before that. But at any stage during pregnancy, it is safe and it is an important way to protect you and your baby. This is especially important if you're somebody who needs to work out in the community and has contact with other people, because right now we know that this virus is transmitting in communities across the province. The second thing I wanted to talk about around vaccines is I get a lot of questions about people who've had previous COVID infections and whether they need to be immunized. And there's been some studies and little pieces of studies that have looked at the immune response in people who have had COVID and compared that to the antibody response after vaccination. There's a study out of Israel. One of the things that I can say is over 175,000 people we know in British Columbia have had COVID-19, and many people wonder if they need to be vaccinated. And the short answer is yes. We have looked at these data from across Canada, from around the world. We've looked at the information around antibody levels. And one of the things that we know is that the antibody levels after infection can be very varied. Some people's immune response can be really overwhelmed by infection, even with a mild or moderate infection, but particularly if you're hospitalized. And you may not develop that long-term immunity that protects you from reinfection. As well, some people have a milder illness and they may not stimulate the whole part of their immune system. We've talked about this before, how there's what we call a humoral immunity, so those antibodies that are in your blood, but there's also the cell-mediated immunity, those memory cells, the B cells and T cells, and they're the ones that stand on guard and recognize if you're exposed to the virus again. Some mild infections can be fought off and not really stimulate that cell-mediated response. As well, the virus continues to evolve, and we see that with a number of other viruses like influenza, where it changes rapidly and it can evade your immune response, particularly if you were infected and had a milder infection with one of the strains that was circulating a year ago. It's inconsistent in how people respond and how their immune system responds to this virus. So while many people will have a high level of protection for a long period of time, we don't actually know what the correlate or how much antibody you need to have to protect you long term. With the vaccine, however, we do know. We know there's a measured amount of antigen. We know that it gives broader protection from the vaccine against different strains, even if they change or mutate. And we know now from the vaccine effectiveness studies that we've done, both here in BC, across Canada, and internationally, that we have a standard response that lasts for a long time from vaccine. And we know that memory cells are activated very effectively with these vaccines. We also know that some people who've recovered but have had long COVID symptoms actually find their symptoms get better after immunization. For a number of reasons then, it is important, even if you've recovered from COVID-19, to receive a course of vaccination. It's recommended by our National Advisory Committee, and it's recommended by experts on immunology, and it is the best and most longer-lasting, durable, and wide-ranging protection that you can have, even as this virus is changing over time. Also want to move on to some of the other things we know are happening right now. Currently, we know that the Pfizer-BioNTech vaccine studies in younger children aged 6 to 11 years old. Their phase 3 studies, the phase 2-3 studies are being finished now, and we know that they're going to be submitting what we call the data package on how well they work and how safe they are to Health Canada within the next few weeks, and I think that's very good news. That gives us just one more tool to be able to protect younger children against this virus. And our immunization teams across the province are actively preparing to be able to offer this vaccine as if and when Health Canada approves it for use here in Canada and it becomes available. So we do know there may be some delays before the manufacturing process means that this vaccine will be available for children in BC, but we are preparing so that we're ready to offer it, and we have all the information that parents will need to make those decisions about whether their children should be immunized. And I think this will be really important, especially as we're into the school year again. I also want to talk about our ongoing pandemic management. While getting our vaccines are the most important tool that we have now to try and combat these rising cases that we're seeing, I also want to reassure everybody that the public health fundamentals of case management, contact tracing remain in place. Contact tracing is a pillar of our COVID response, and we will continue to be as we go through this wave as well. Every new case must continue to self-isolate. That is not changed here in BC, and every exposure is investigated. I will say that it has been challenging with rapidly increasing numbers in some of our more strained areas, particularly in the north, and there may be delays in finding people in some cases. But if you test positive for COVID, you must self-isolate. That's how you protect yourself, your family, those you're closest to, and make sure that you're not spreading it in the community. But our public health teams are working across the province. We're scaling up again to make sure that we have the ability to find every case and to identify particularly contacts who are in high-risk settings. So if you're in a communal living setting, if you're a healthcare worker, in a school, university settings, those are the risk settings that we are focusing on, and we will be following up. We know the risk of spread to and from someone who is immunized is much lower. So vaccinated contacts, and this is a change that we made once we had high immunization levels in the summer, vaccinated contacts no longer need to self-isolate, but they must continue to self-monitor and to isolate and get tested if any symptoms develop. So that is a change, and I know there's been some confusion about that recently, but cases, absolutely. If you're sick with COVID, if you test positive, you must self-isolate. If you're a contact of somebody in a low-risk setting and you've been vaccinated, you no longer have to self-isolate for that 14-day period, but you do need to monitor carefully and get tested. I'd also like to remind people, of course, that we all, as we're moving into fall, we know that there's other viruses that are starting to cause respiratory illness, and we need to continue to use all of our layers of protection, including washing our hands, staying home, staying away from others if we're feeling unwell, making sure that we're wearing masks, especially in indoor crowded places, and making sure everybody who's vaccinated against COVID, who can be, is vaccinated. As you know, as we're moving into fall, schools have opened again, and I want to provide an update on school notifications. Initially, it was my understanding that there was a level of anxiety from the way that we had given broad school notifications last year. But we hear from parents across the province, I hear from educators, and our teams have recognized that parents do need an authoritative source to go to have an understanding of what's happening at their children's schools. So we've heard that, and I've asked our team to get together right now to make sure that we can notify schools in a timely, less intrusive and more sustainable way, and that parents will have access to that information rapidly. And I hope to have that in place by the end of this week so that you can have an understanding of what is happening at your child's school. I do want to reassure you that, as I just talked about with case and contact management, if your child has COVID, if your child has been exposed to somebody with COVID in a school system, you will be notified. It does take time to follow up on each individual case, and that sometimes can be take longer than you expect, but you will be notified. And public health teams are prioritizing our schools because we know how important it is to make sure that children are safely in schools and able to have all of the learning experience in the school setting. I will also say that this year is different because we have so many of our school staff and students protected through vaccination, and encourage everybody who is able to continue to get protected through vaccination. So to conclude, I want to also thank the millions of people across our province who have been vaccinated, including those who, until more recently, weren't able to find the time or didn't make that effort. Your efforts do count, and it is making a difference, and it's incredibly important for us across this province as we are seeing this virus continue to spread, and we know that it means that people who have not yet been protected are ending up in our hospitals, and that's stretching our healthcare system. I also want to extend my gratitude to the hospitality center, the gyms, the fitness centers, the movie theaters, the symphony, the arts, who have all now started to use the vaccine card and to be able to get back to some of those incredibly important social, sports, and arts activities that we've so missed over the last year and a half. We are all now a little bit safer as a result, but we are in this storm together. And it continues, and we will get through it together by continuing to do what we have done in BC all along, by respecting and being kind to each other and being compassionate and staying safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by saying that I'll be addressing three topics today. One, the situation in Northern Health and the pressures on the healthcare system then and some of the actions that we are taking. Secondly, the impact of COVID-19 on surgeries, ICU and hospital capacity in BC, providing some information on that. And finally, further to Dr. Henry's comments with respect to contact tracing, to the efforts to ensure our contact tracing capacity continues to meet the needs in all the regions of British Columbia. Before I address these 3 points, I'd like to address one more, so I guess that makes it 4. I want to acknowledge that we've heard from British Columbians whose name on their BC vaccine card did not match the name on their ID. We've worked over the last week to solve this. The BC vaccine card has been updated to ensure that the name that is displayed matches the name on your BC Services card or combined driver's license and BC Services card. If the name on your BC Service vaccine card currently does not match, you can go to gov.bc.ca/vaccine card for an updated vaccine card. If the name on your BC Services card is incorrect, please visit gov.bc.ca/updateid. Alternatively, you may contact Health Insurance BC toll-free at 1-800-663-7100. I would note that as of this morning, 2,987,031 people have got their vaccine card in BC. That's in the less than 2 weeks that it's been offered. I want to thank everyone in BC involved in it, all of the people working who monitor and watch and look at the vaccine card when they come into restaurants and other cultural facilities and other places in BC, and all the people in BC who have supported this program. Almost 3 million people is a very impressive result and demonstrates, I think, the desire of British Columbians to ensure that everyone is safe in our province. I want to say that more than 4 million people, 4,024,302 as of Sunday night, British Columbians have now received their first dose immunization of a COVID-19 vaccine. That's 86.8% of eligible people as of Sunday night. I want to acknowledge, as I've noted before, that this rise in vaccination rates has been led by people 18 to 24, 25 to 29. As of now, 89.1% of all those 18 to 24 across BC have been vaccinated, and 87.6%, again, above the provincial average of those 25 to 29 have been vaccinated. I want to say how impressed I am, because even on the weekend, even today, the largest number of new registrations have come from young people, and I am very, very both impressed and thankful for their effort and their leadership during this period of vaccination in the pandemic. 79.4% as of Sunday night were fully vaccinated, meaning they've received 2 doses of a COVID-19 vaccine. And while we're clearly making great progress with respect to vaccination in our province, when you think of that, we'll be down today to just over 13% of people unvaccinated. The reality of vaccination and the seriousness of the COVID-19 pandemic continues to face us. As you know, as of again, Sunday night, 156 people were in critical care in our province with COVID-19. 138 of those were unvaccinated, meaning that those people, the unvaccinated, are remarkably vulnerable right now to COVID-19 and its most serious effects. And while we're making progress, as I say, with vaccination across the province, some areas are, of course, lower than others. If we are at 87% of the 12-plus population in BC had their first dose, and 79.4% their second dose. In the Northern Health Authority, those numbers are 75% of the 12-plus have received their first dose, and only 65% their second dose. In the Northeast region, within the Northern Health Authority, there's also significant differences between areas. For example, the Community Health Services area in Kitimat is at 95% vaccinated. We have high vaccination rates in Nisga'a and Haida Gwaii, high vaccination rates in Prince Rupert and in Terrace. But, and you can see in the numbers as well in those regions a lower level of COVID-19 infection. But in the Northeast, for example, just 61.2% of those eligible are vaccinated with their first dose. In the Northeast region of the Northern Health Authority, if you cut it into 3 regions, 61.2% of those eligible are vaccinated with their first dose, and 50.5% are fully vaccinated. And the consequences of these vaccination rates are clear. We see them in our hospital. They put our healthcare workers and our healthcare system to the test, and they, of course, lead to people getting sick who do not need to be sick. And I want to be clear, we treat everybody with the best healthcare in the world. Our outcomes in ICU are the best in the world. We are going to continue to do that. This is not a question of blaming people for being sick, but we need people to understand the critical importance of vaccination. The northern region, over the past last 7 days, is averaging 41 new cases per 100,000 population. That's more, and just compare that to other regions in BC. That's 19 in Interior Health, where we still see far too many cases, 11 in Fraser Health, 9 on Vancouver Island, and 7 in Vancouver Coastal Health. Northern Health also has more cases per 100,000 of the population than any other health authority, more total cases by a wide margin in the last 7 days. These exceptionally high case rates are translating into hospitalizations and putting significant pressure on ICU capacity and health workers. The North is being overstretched by COVID-19 and overstretched by the fact that we are not meeting, to the extent that we need to meet them, our vaccination goals in Northern Health. And this is not because, and let's be clear, a vast majority of people in Northern Health have been vaccinated, and the extraordinary efforts by public health to vaccinate it, and the support of mayors and MLAs, and I want to particularly acknowledge the support of the Liberal health critic and leader of the opposition, Shirley Bond, in these efforts, MLAs such as Diane Davies and Mike Bernier, MLAs such as Nathan Cullen and Jennifer Rice. There is a lot of commitment and a lot to be proud of, but we simply need to raise those levels. There are 3 active outbreaks as well in Northern Health, including the Fort St. John Hospital, the Site C project, and Jubilee Lodge. We've taken steps to manage and ensure that quality care is provided to patients in the North, and will need to take further steps in the weeks ahead. As you know, on September 7th, new restrictions came into effect in the region, including restrictions on personal gatherings and events. In addition, to recruit and retain the people we need in Northern Health, and this is a broader problem than COVID-19, we are investing immediately up to $6.38 million for programs and incentives to encourage more healthcare workers to discover the advantages of working and living in Northern Health. Our commitment to ensure people in the North get the COVID care they need have required us to make the difficult decision to transfer patients from the North to Vancouver Island and Metro Vancouver for critical care. So far, a total of 12 patients, 9 of which are COVID positive. We expect the pressure on critical care in the North will continue until vaccination rates go up and cases and hospitalizations go down. We need to reduce pressure on the North, and as such, we are adding additional capacity outside of the North so we can provide the care to the patients who need it. We've worked with Vancouver Coastal Health, Fraser Health, and Island Health to identify dedicated ICU capacity incremental to what we've done already for patients from the North. 10 beds in the Lower Mainland and 5 on the islands. 15 high acuity ICU or ICU beds. Clearly, this is less than ideal. It will be difficult for those patients and their families and their loved ones. But these are necessary steps to ensure people in the North have access to quality care and to support our healthcare workers in the North, in the region, to do that. And this is what's happened in BC since the beginning of the pandemic. I want to make this point, and it's an important one. Initially in the pandemic, the largest number of cases were in Vancouver Coastal Health. There was a period in the pandemic when we had significant cases in Fraser Health. There was a period, both in the summer of 2020, but particularly this past summer, when we saw very high case counts in Interior Health. And now we see them in Northern Health. In British Columbia, we support each other, we provide resources for each other, and we're going to continue to do that. The most important thing we can do now, all of us, is to get vaccinated. The steps we are taking manage the situation, but vaccination is a solution. Please get vaccinated and follow public health orders so we can turn this around. Looking more broadly across BC, as of yesterday, as we reported, 307 people are in hospital with COVID-19. 156 are in critical care. And the very significant share of those, 138, were unvaccinated. 5% of COVID-19 patients in ICU are fully vaccinated, and they represent 80% of the population. Prior to the pandemic, our emergency departments were busy. People need critical care for a range of serious health issues. And of course, we have been completing more and more surgeries in British Columbia, and we're very proud of what we've done. But the arrival of this 4th wave has required us to postpone surgeries and to put safety protocols in place in hospitals so that staff are freed up to care for COVID-19 patients. And we have, as that's happened, as you remember, in phase 1 of the pandemic, it happened in wave 3 of the pandemic, and it's happening now. We fought through each wave of our BC pandemic. The normal demand was then returned. The fourth wave in particular is creating pressures. Some of these pressures we have highlighted before, such as the pressures on Royal Inland Hospital. I want to be clear on this point. We have the power to turn this around. We can reduce pressure on our hospitals and staff currently by a simple act, a decision of solidarity, an act of good citizenship, getting vaccinated. Our healthcare workers continue to deliver the very best care possible to every patient. But it's not simply a matter of continuing to ask them to do more. We cannot keep asking them to compensate for the devastating consequences created when people make the decision not to get vaccinated. The smartest, safest, and soundest decision right now is to get vaccinated, and I, of course, strongly encourage you to do so. Last week, I reported that as a result of increasing pressures from COVID-19, we had reduced non-urgent scheduled surgeries in several health authorities. This has continued to be the case from September 12th to September 18th, during which time the health authorities postponed 511 non-urgent scheduled surgeries. Every one of those surgeries is medically necessary. Every one of those surgeries will be done, but they've had to be delayed because of COVID-19 pressures on our hospital. That's 47 in Fraser Health, 176 in Interior Health, 167 in Northern Health, 87 in Vancouver Coastal Health, 34 in Vancouver Island Health. No surgeries were postponed in the Provincial Health Services Authority. So for the 2 weeks, from September 5th to September 18th, there have been 798 surgical postponements. I would note, and this is a part of the regular report as well, that from August 29th to September 4th, health authorities report 5,865 surgeries were completed, and that is and continues to be impressive output by our healthcare system under these circumstances. This is obviously not where we want to be during our BC pandemic. It's not where we needed to be. These pressures experienced by our hospitals right now were preventable and can still be reduced. It is essential those who have not been vaccinated and are eligible to be vaccinated make the decision we are all counting on them to make. Another priority of our COVID-19 response continues to be contact tracing, as Dr. Henry has reported. Contact tracing has always been a key part of our pandemic response, and that hasn't changed. The number of contact tracers and the capacity of the contact tracing system has been scaled up and down during the pandemic as needed. When we had well over 10,000 cases in April, there was obviously an enormous number of contact tracers working and people supporting them and tracing aids working in the system. That number was reduced when we dropped down below 1,000 active cases. We're now in the 5,000 to 6,000 range in terms of active cases as of yesterday, and we obviously need more. By health authority, those numbers are as follows. Our current total of contact tracers, 123 in the BC CDC. We expect to be adding 42 in this next short period. 100 in Vancouver Coastal Health. We'll be adding a further 53. 126 in Fraser Health. We'll be adding an additional 49 contact tracer aides there. In Interior Health, 130. And we will be adding 50 full-time FTEs and casual contact tracing supports there. In Northern Health, we have 60, and we are adding 3 there, but obviously a very significant impact on Northern Health right now means that the BC CDC resources are being applied overwhelmingly there. And on Vancouver Island, we currently have 56 contact tracers, and we will be adding 113 in the next short period. This is comparable to, in most places, except for the Metro Vancouver area, to the peak period, the staff at our peak period of contact tracing, which was in the spring. I want to thank everyone involved in that and encourage everyone to continue to support, and our decisions to increase that capacity over time have benefited British Columbia in our COVID-19 response. But they've also benefited individual students, individual patients, I should say, and individual people living with who have tested positive for COVID-19 in every part of BC. I want to thank everyone working in our healthcare system, who work as contact tracers, vaccinators, in long-term care and assisted living, and particularly those in acute care right now, for their continued work in this challenging time to care for and protect us. And I continue to call on everyone to think of our healthcare workers, think of one another, and get vaccinated as soon as possible. We have done well in BC. We've done better than just about any jurisdiction in the world. We're down to 13.2% of people unvaccinated, but we simply have to continue to reduce those numbers. Because as you see, when you're fully vaccinated, your chances of ending up in hospital or in critical care are so dramatically lower than if you're unvaccinated. It is not a risk. Not getting vaccinated is simply a risk that you cannot take, and one that effectively people will be taking not just for themselves, but for the entire healthcare system. I want to thank all of you and look forward to answering your questions.
Thank you, Minister. A reminder to media on the phone to please press *1 to enter the queue for questions. You'll be limited to one question and one follow-up today. Please also remember to take your phone off mute, as you will not be audible until your name is called. Our first question today comes from Richard Zussman with Global News. Go ahead, Richard.
Dr. Henry, I'd like to know how many pregnant women are in ICU in BC right now, but my larger question is just about the pressure that's on the system. How close are we to a breaking point in our healthcare system in Northern Health? Are we concerned about a breaking point in the system elsewhere? And Minister, you speak about those in the system giving all they can give. Why not put in even stricter measures to require the population to be vaccinated in order to help manage that pressure? Are we on a verge in Northern Health of getting to what we're seeing in Alberta?
Yeah. So in terms of numbers in ICU, I don't actually have that as of today. I know there's close to under half a dozen at the moment, but people move very quickly in and out of ICU because of the care that they get. So I do know that we've had 40 people who've been pregnant in ICU over the course of the pandemic, and a good proportion of those have been in the last few months. In terms of, I think we're in a very difficult place in many parts of the province, because we've all been doing this for 18, 20 months now. So our teams are tired, and there's a moral distress that we feel when we are seeing people who are suffering from a preventable illness now. And that's a challenge that I hear from my colleagues in ICU in particular, but in hospitals across the province. It's also very challenging in public health, because we see its direct correlation of certain communities where immunization is lower. And we spread this virus, as I've said all along, we spread it to those people we're closest with. The people that we are indoors with, that we live with, that we work with, that we have social gatherings with, and it's being spread across communities in the north from people who inadvertently take it with them when they go to celebrations of life, to funerals, to birthday parties. And those are the things that are most dangerous for us right now if we're not protected through immunization. And what we see is spillover into long-term care. We have healthcare workers who are ill. So these are strains that are on top of everything that we've been through over the last 20 months. So that's the challenge that we have. I don't think any of us are at the breaking point. We've always continued to do the case management. We've never stopped that, as they did in some parts of Alberta. So we are in a different place, but sadly, as a country, we're not in a place in BC where we can support taking people from Alberta for ICU care, for example. But you can talk.
I think, Richard, what you're witnessing is the strength and the power of public health care in BC. You see it in the quality of the outcomes people have overall in ICU, because anyone in ICU with COVID-19 is seriously ill. And you're seeing in our response, in our outcomes, and the efforts of our healthcare workers, the extraordinary response of public health care to people who need care in our province. And also, I think, it's strength and flexibility. I have to tell you that this past week, as I just reported, 511 non-urgent scheduled surgeries postponed. These are the things we can do to manage it, and we will continue to do those things to manage the system and ensure we can provide care for people. Well, let's be clear, we'd rather be doing those surgeries. And surely those 511 people who have medically necessary surgeries postponed would rather that we're doing them, because there is anxiety, and that's why we've made the commitment at every phase that we've delayed surgeries to get those surgeries done as soon as possible, and we have proven that again and again and again in this pandemic. What's going on now is that at the BC CDC and in other health authorities, we're supporting Northern Health because support is required, just like they would for us if the situations were reversed, and have done for us. And this is the work we have to do together, but this is the healthcare system working effectively. So what are the other actions we're taking? Everybody in healthcare, as you know, in long-term care and assisted living, will need to be vaccinated by October the 12th. In the broader healthcare system, everyone patient-facing will need to be vaccinated by October the 26th. There's a province-wide mask mandate in place, as you know, for indoor public spaces, and a series of other measures, particularly in the northern and interior health authorities. These are the steps we're taking, the tools we're taking to help deal with COVID-19. But the most effective one, you can see it. You can see it in the numbers every day of those seriously ill, is to get vaccinated. These numbers are rising. We've just got today's numbers. We're at 87%. People vaccinated across BC, and we've got to continue to drive that upward. And I am happy to report that people are registering every day, but we absolutely need to focus those efforts and encourage people, particularly in the Northern Health Authority, to get vaccinated. And it's not to single out Northern Health. People are workers in Northern Health, and the vast majority of people in Northern Health have been vaccinated, but we simply need that number to get higher. There is a path through for Northern Health, and it starts with vaccination, and we have to continue to make those efforts. So our healthcare system is delivering what it has delivered throughout this past year, which is extraordinary work by healthcare workers, an exceptional increase in the resources provided to the system, of course, as you would expect, and as we are doing, to ensure that when we cancel surgeries because of these circumstances, we get people the surgeries they need, that we increase, as we did from August to August, the number of surgeries we did over 2019, an extraordinary achievement in the pandemic. We've got a remarkable healthcare system, but this number of people in ICU, and remember we hit 183 in the month of April. That was our previous high in terms of people in ICU with COVID-19. The 156 we reported yesterday as of Sunday night is a significant number. And with 138 of those unvaccinated, that is significant resources in the system. So what do we need to do? We all need to get vaccinated.
Richard, do you have a follow-up?
Yeah, on that point of everybody getting vaccinated, you mentioned the mandate coming into effect in healthcare. Do we have a better sense of how many healthcare workers in this province are immunized against COVID-19? Are you worried that there will be additional pressure on the northern healthcare system? Yes, I think we can assume that healthcare workers are vaccinated at a higher rate than the population, but Northern Health may be lower still. Are you worried that we may have another blow to the system there, and do we even know how many people may not be immunized by the deadline?
Yeah, so we're working on that. As you know, I've compelled the information for long-term care for both residents and anybody who's working in a long-term care home, regardless of whether it's a health authority or a private care home. And those data are coming in. It's always more challenging than we expect when we have to create a portal to obtain information on and then link it with the immunization registry. So we should have more data on that. Excuse me. But at the facility level, people are now being, in the healthcare, long-term care and assisted living facility level, people are now being tested if they are not yet vaccinated. And we are reaching out to every individual person to make sure that we've answered their questions and made sure they have access. And we've across the system started to do that as well for all healthcare workers who will be affected by the mandate. So I don't have exact numbers for you off the top today, but those are issues that we are absolutely addressing. And I think we need to put it in the context, and we talk about the strain on healthcare workers. And part of that strain is healthcare workers who are not yet vaccinated becoming ill themselves or having to be off because they've been exposed to somebody who's ill. And as of last week, we had over 100 healthcare workers who were in isolation, ill with COVID, or because they've been exposed and weren't yet vaccinated. So it is a strain having this much transmission in our communities, and we as healthcare workers being at risk as well. So all of those things are ones that we have to address, and some of the things I talked about today were the questions that I'm getting from people, and very legitimate concerns about vaccination in pregnancy, for example, whether it's safe if you're breastfeeding. So those are all important questions that we do have answers to, and that we need to get that information to people so that they are protecting themselves.
Our next question is from Justine Hunter with Globe and Mail. Justine, please go ahead.
Hi, thank you. The BC Nurses Union rejects the vaccine mandate for healthcare workers, and they say that it could force thousands of workers who are very much needed out of the system. I'm wondering, given the stress on healthcare workers broadly in BC, what is the plan to address any shortfalls in staffing that is caused by the vaccine mandate?
Yeah, so I think that's we know that there are much higher levels of immunization in healthcare workers, and that they are increasing on a daily basis, and that this mandate has been an impetus for some people who have had concerns to make sure that they get those questions answered. So I don't believe there are thousands of nurses that are going to be impacted, and as a matter of fact, I certainly get a lot of strong positive support for this from those very nurses who are on the front lines and see the impacts of people who are not vaccinated and what can happen with this virus. These are things that we are working on now. We have a process to make sure that people who have a valid medical exemption are able to be accommodated, and each health authority is working on a strategy to make sure that we have a plan, both for long-term care and assisted living, but also for across our acute care system and our community care system. I don't know if you want to say anything more about that at this point. Yeah, so these are things that obviously we're looking at. We need to support healthcare workers across the system, whether your work as a cleaner in the ICU, whether you're a nurse, whether you're physicians, to make sure that we all have access and have our questions answered so that we know that we're making the right decision.
Justine, do you have a follow-up?
Yes, thank you. I was looking at the healthcare contracts, and it looks like all the major unions have language that does allow the employer to require vaccination. So on what grounds can a healthcare worker in BC refuse to be vaccinated? And can you, on the flip side, address the rights of healthcare workers to a safe workplace?
Absolutely, and this is one of the, the reason why we're putting in this, one of the reasons why we're putting in this mandate is worker safety. We know that. We know that healthcare workers who bring COVID into, whether it's a long-term care home or their unit in a hospital, that it spreads to other healthcare workers, because we have those opportunities, whether it's in the break room or whether it's carpooling to work together. We do know it spreads to healthcare workers, and so it is part of our work and worker safety within the healthcare setting, as well as individual protection and individual safety, because people who are going to work in the healthcare system are exposed to COVID. So in terms of, yes, it is in the collective language. We've been working through all the details of what that means in terms of employer-employee relationships. And as you know, we need to have a process to address people who have valid medical exemptions and how they can be accommodated within our system. So all of those details are working out, and there'll be a centralized, consistent process so that it is the same whether you're somebody who has a medical reason why you can't get a vaccine in the north or in Vancouver Coastal. So we're working that through my office and through our expertise in immunization in the province.
Our next question is from Penny Daphlos, CTV. Penny, please go ahead.
Oh, hi there. Thank you for taking my question. I just wanted to start out with one for a colleague, and she's just looking to get an update on the integration of our QR codes and vaccine passports with other provinces, both in terms of people coming here and showing proof of vaccination, as well as British Columbians traveling outside the province.
Yeah, so these are things that right now we all have our own systems. Our QR code and the one in Quebec is very similar, but slightly different. And I know I've heard from some people who've been to Quebec and said that they didn't, the scanner doesn't recognize the QR code. But it can still be a perfect, a valid visual check. And we are working with the federal government to make sure that we have an interoperable system across the country, but it's not there yet. And what we are accepting here in British Columbia is the proof of vaccination, and we have some tools for businesses about what to look for and how to, which are valid proof of immunization from different provinces. But you know, our expectation is as things roll out and different provinces start to take this up, particularly Alberta, Ontario, New Brunswick, behind the scenes we're all working together to make sure that we know what each other's doing, and that at some point it'll be interoperable together with a federal program as well.
Penny, do you have a follow-up?
I do, and it's just around hospital statistics. When you've been publishing the daily list of COVID patients in ICU and the statistics, I don't think we're really getting the full picture. I know that there's an internal number of COVID patients who were classified as time cleared or off precautions, for example, that health officials are keeping track of, but that aren't discussing publicly. So I want to know how many patients fall into that category right now, and why you aren't being more transparent with the public about how many people have been admitted for COVID and are still hospitalized and not included in the daily numbers.
So I'm not sure. There's a couple of things that we are looking at. So there's epidemiologically linked cases. So cases, there's the difference between somebody with COVID who is hospitalized or needs ICU care or dies, and that's a measure of the severity of illness, and we do that on an individual by individual level. And there's a census, which is anybody in hospital who tests positive for COVID. So those are two different measures, but yes, we do look at the severity of illness, and that is on a case-by-case basis. So how many, and that's what we present in the weekly surveillance reports, for example, that tell you how many new people are admitted, how many people who've had COVID in different age groups need hospitalizations. That's the important epidemiologic information that helps us understand the impact of the pandemic. And then there's the census information, which helps us look at healthcare system impact on a day-to-day basis. So what we present in our data is the epidemiologic numbers, and that's the way we've done it from the very beginning. It helps us understand severity of illness. That's the important thing from an epidemiologic perspective. We also, of course, monitor census information and people with COVID, people with other issues in hospital as well. I'm not sure if that answers your question. I think what we report on a daily basis as well is based on the epidemiologic information and on the census information, and it is the rough, not age-adjusted, not corrected data over time, the rough data of what proportion are immunized, etc. Do you want to add?
Our next question comes from Scott Brown, Vancouver Sun. Scott, please go ahead.
Hi there. I just wanted to get back to Northern Health. How many ICU beds and surge critical care beds are there in Northern Health right now, and how many are occupied?
We'll do. We get our daily report later today. I'll send all that information to you, Scott. Yesterday, there were 20 people with COVID-19 in our ICUs in Northern Health, and that's obviously a significant number of people, and that doesn't include people who have COVID-19. I believe 6 of which have been transferred out of Northern Health. So those are significant pressures. Yesterday, we had 53 people in hospital, I believe, in Northern Health with COVID-19. When we had those high periods in March and April, that number was 45 or 46. But all that information we'll regularly provide, and I'll just provide it to you by hospital and throughout the health authority. But what I'm telling you, I think, is pretty clear. And we're talking about moving people. We do that with great reluctance, because obviously, when you're sick, having to move someone from Fort St. John or from Prince George or from Vanderhoof down to Vancouver or to Victoria is a significant challenge for themselves and for their families. So we do it with great reluctance. The fact that we're prepared to do it and are creating space for it over the next week to ensure that Northern Health can plan appropriately, I think is the right path. But we'll give you all the data by hospital and throughout the health authority, and we can provide that generally to everybody. I think we've provided it many times before. I'm happy to provide it again, Scott.
Scott, do you have a follow-up?
Yeah, just checking the Peace River South and Peace River North and Port Nelson, the full vaccination rates there hover around 50%. How do you explain the hesitancy in the North towards getting the COVID-19 vaccine, and what is being done to combat that hesitancy?
I think there are many different reasons, and different communities have different reasons. And we hear from a lot of people about some of those reasons. We know in some of the more rural areas, it's about access, it's about timing, it's about how do we get vaccine to people and making it easy for them. There was, for a very long period of time, very few cases across the north, and there was a sense of complacency that this isn't really needed. There are some communities where there's a real resistance and fear about immunization. There's also some communities where some leaders are whether it's faith leaders or community leaders, are actively against vaccination. And so we have a number of different strategies to address whatever the issues are. We have been taking a vaccine out to rural areas, doing drive-ins, meeting people where they're at. That's one thing. Making sure we answer people's questions. And, one of the things around the vaccine card is actually an impetus for people who are a little bit complacent to say, hey, this is important, and it continues to be important. And we've seen that in the north, where we have pockets of people who are unimmunized, similar to what we saw in some communities and still see in some communities across the interior health. It can spread very rapidly, and very rapidly to people who may end up in hospital. And we hear that from some people, that there's a small proportion of people who are still in denial, even when they're in hospital and ICU, that it actually is COVID that's making them sick. So those are challenges that, as healthcare workers, we're public health on the front lines, whether it's in the hospital or ICU, that having to deal with some of those issues makes it very difficult as well. So we're providing support in as many ways as we can to answer people's questions, to help them understand the rationale, to help them understand as well, to answer people's questions about the vaccines. And I think there's, and I've said this many times, there's misinformation, which is just things that are unintentionally wrong, or bits of information that are taken out of context. But in some cases, and particularly on social media, there's very pointed disinformation, intentionally misleading information that is sent out there by certain groups of people to incite fear about the vaccines. And we see that in some communities across the province as well. And that is the important, really challenging, difficult place. It's particularly on social media, and really what we need to do is have venues, have places where people can actually get credible information that helps allay some of those fears. And that's one of the reasons why I really wanted to talk about pregnancy today. why I wanted to talk about some of the other concerns that we're hearing from people because of the intentional scaring that goes on in some of these, particularly social media sites that are just plain wrong. I can say unequivocally, these vaccines do not affect fertility, both in women or in boys or in young men. They do not affect fertility. There's no way that they can do that. But that is one of the common lies that is out there right now, designed to create fear. So there's many different strategies we have to take depending on what the issue is.
Yeah, I think we have to put it in context. In the Northern Health Authority, about 76% of people have received their first dose immunization. And generally, we found that first dose leads to second doses. So the vast majority of people in the Northern Health Authority have been immunized against COVID-19. And I want to say that one of the communities, the most immunized in British Columbia, is Kitimat, at 95.9%. In that community health service area, 7,931 people immunized, 337 people remaining to be immunized. So in that part of the north, a very high level of immunization. There are in other parts. But even in Fort St. John, where we've had extraordinary support from Mayor Ackerman, we have extraordinary support from the local MLA, Dan Davies, and from many in the communities. We're going to continue to work our way through. Dr. Henry and I are again meeting with Northern leaders tomorrow, doing a lot of work in Indigenous communities as well, and the Provincial Health Office is doing that. And we're just going to keep grinding those numbers up, because every percentage point, every person makes them safer and everyone else safer. And we're just going to keep working with communities to get those numbers up. As you'll recall, there was a time when Fort St. John was just under 50%, and they were well below. They've now, that number has significantly gone up, say, in Fort St. John. It's significantly gone up in Tumbler Ridge. It's at 67.2%, but we need it to be higher than that. And I also want to acknowledge that in Prince George, we have immunization rates in the 3 urban community health services areas that are 86, 83, and 80%. So this is something we just got to keep working through. As we talk about sometimes, it's a ground game. It's person by person, and we are offering opportunities in the north today to get vaccinated. And I encourage people, if they want to support their healthcare workers, if they want to support those who are struggling in ICU right now with COVID-19, if they want to support their communities, to get vaccinated, to take this opportunity now to get vaccinated. It will make a difference now. It'll make a difference in October and in November and in December. And I encourage everyone to do so. So I think we can continue to make progress, and we're going to continue to be positive about it, as I think we have enormous support. The vast majority of people in the north are vaccinated and support vaccination.
We have time for one more question today, and that will be from Isabel Ragam with CBC. Isabel, please go ahead.
Hi there. I'm hoping for an answer in French as well, please. The hospital in Prince George is the only one in the north caring for long-term critical care COVID patients. Yesterday, there were 20 patients in the region with just 21 beds. How are we managing that situation beyond telling people to get vaccinated to avoid healthcare workers there being overwhelmed?
Well, I laid out the significant measures that are being taken, including the creation for the Northern Health Authority of 15 ICU beds in other parts of the province. And so we're obviously working to support healthcare workers everywhere. There are COVID-19 patients in Fort St. John, and of course at Mills Memorial as well. But there's a huge burden on the University Hospital of Northern British Columbia and Prince George, and we're doing it as we are everywhere. As you know, we have about 510 base ICU beds or critical care beds across the province. We also have 200 plus, I think it's 230 plus surge beds around the province. But again, the key always is staffing and supporting the staff in Northern Health, and that's why we're providing these options to reduce the stress, particularly on the University Hospital of Northern British Columbia and on the hospital in Fort St. John. Those are 2 hospitals that are under stress right now as a result of COVID-19 and other circumstances, and so that's why we're taking these measures. We're increasing investment for recruitment and retention. We're supporting every day the Northern Health Authority, and we're taking specific action, which I described earlier today. En français, nous avons pris des actions, que ce soit des actions pour des programmes pour retenir le retentissement et le recrutement des infirmières et d'autres dans le nord de la province, que ce soit des médecins, des infirmières, des travailleurs dans le système de santé et des travailleurs qui travaillent pour la Health Sciences Association ou qui appartiennent à la Health Sciences Association, etc. Donc, on a pris ces actions. On a pris des actions très directes dans les derniers jours pour transférer un certain nombre de gens qui sont sérieusement malades actuellement à l'île de Vancouver et à Vancouver pour qu'on puisse réduire la pression sur nos hôpitaux dans le Nord. On va continuer à faire cela. On a identifié 15 lits dans nos ICU dans le sud de la province pour soutenir le Nord pour cette raison-là. Mais ce qui est essentiel, ce qui est fondamental, c'est que tout le monde dans le Nord est vacciné aussitôt que possible. En augmentant notre niveau de vaccination, on va réduire la pression dans notre système de santé. Ça c'est simple.
Isabel, do you have a follow-up?
I do. The mayor of Fort St. John, along with MLA Dan Davies and other elected officials, are calling for an audit of Northern Health, citing longstanding staffing issues. We've also heard from a few healthcare workers saying that Northern Health is telling them to not speak to media and not talk to the public about their experiences. Just wondering, how would you respond to the potential audit of Northern Health and medical workers being told not to speak about their experiences to the media?
I've met with Dan Davies. I've met with Mayor Ackerman. I've met with nurses in Fort St. John. I think what they were asking for is not, as I understand it, an audit of Northern Health in general. They had concerns about Fort St. John. And part of our response to those concerns that have been raised was the measures that we put in place last week to assist with the retention and recruitment. And retention is really important as well. We have to, a very significant number of our workers in the Northern Health Authority go there for a period of time and then leave for other places. And we want to make sure that when we've made the efforts and we've succeeded and we've recruited people, that they're retained and their quality of their work is high. So we've discussed that with both Mayor Ackerman, with Mr. Davies, and with other people. But what I'm focused on is solutions, and that's why we announced some direct action last week and why we're taking the very significant actions we've taken today. I don't think there is any secret to the challenges in the Northern Health Authority, and people have spoken about those, and you can see that in the work being done by healthcare workers in the North. When you have 6 times the number of COVID cases per capita as in the Vancouver Coastal Health Authority, it presents real challenges for the region. When you have, and we've had periods, and this is including the patients who have been transferred, where the vast majority, and I mean the vast majority, only 5% of our patients in ICU with COVID-19 are fully vaccinated, that we need to raise immunization rates. And I'm going to continue to work with Mayor Ackerman, who I intend to talk to tomorrow, with Dan Davies and other people, to see that we raise those immunization rates in Fort St. John. And both of those people, Mayor Ackerman and Dan Davies, have been real leaders in that regard. So I think we're working very, very hard. It's pretty transparent. No one is suggesting anything other than this is a significant challenge, and that how we deal with that challenge are some of the measures we've brought in, and they're strong measures, and I think effective measures, but they're not the measures we want. Moving people from Prince George to Vancouver or to Victoria does relieve pressure on the hospitals in the North, but it is not in any way a long-term solution or in any way desirable. I want everyone to know as well, when we transfer patients, we take them back as well. So their transportation is assured. No one is left behind or anything else. They'll be returned to where they went from. So we want to make everyone know that. So everyone's working hard. I don't think there's anything other than an understanding across healthcare in the North and across the public in the North that this is a real challenge. And there's a way we can all deal with it individually, and that's get vaccinated. Je dirais, on a parlé depuis quelques mois avec la maire Ackerman et le député Dan Davies sur ces questions. Il veut une revue du Northern Health à Fort St. John. On a parlé. Ma réponse, c'est de prendre d'action. Et c'est ce qu'on a fait. Je pense que les gens qui travaillent à Northern Health, devant des défis extraordinaires, font un travail extraordinaire. Et je vais continuer à les soutenir pendant cette pandémie et après. Merci beaucoup. Thank you very much.
Sorry, folks, we actually just have been asked to take one more question.
Sorry?
We've just been asked to take one more question.
Okay, one more question.
Yeah, sorry, thank you. Folks, we actually will take one more question today from Marcella Bernardo, News 1130. Marcella, please go ahead.
Thank you. I was having some technical difficulties, so I really hope that I let you know that I appreciate you both taking the time to answer my questions. I just wanted to see if probably Health Minister Dix, because you probably have the numbers right in front of you, but are you able to explain why we're being told now that only 66% of the 150,000 healthcare workers not in long-term care have actually been vaccinated?
I'm not sure where that comes from, but I know that that's not correct.
Yeah, I mean, hi, Marcella. I don't know. That number is just not correct.
Marcella, do you have a follow-up? Marcella, do you have a follow-up?
Yes. If somebody could clarify what is the number of the percentage, and if possible, Dr. Henry touched on this a bit earlier, but I'm hearing from several healthcare workers who are vaccinated that are very emotional and upset because they don't want to be working alongside people who are not doing everything they can to stop the spread of this deadly disease and this deadly virus. So I guess what is your message to the people who claim they're reluctant to get the vaccine and what they should be doing in order to keep their coworkers safe?
87% of people in BC, all the people in BC as of today's report, as of last night, have received their first dose immunization. I think 79.6% are fully vaccinated. That's the vast majority of people in BC. Only 13% of the whole province are unvaccinated. The number of healthcare workers is lower than that. The reason we took this measure is because, as Dr. Henry has said when she announced the measure, that the risk in long-term care is very high when people get sick. The risk in assisted living, the risk in our healthcare system. And that's why we've taken these measures to ensure that everyone working there is vaccinated. And these are not without challenges, and some of those challenges have been identified, right? We'll say you don't want to lose anyone in the healthcare system right now, and I agree with that. But everyone needs to get vaccinated. There's a period until October 12th to do so, and we're working hard to give everyone the opportunity to get vaccinated. And I think what we want to do, and I think what's happened throughout this pandemic, and we want to continue to see happen, is that people are brought together here, that they're not divided in the ways you describe. And so, yeah, I think there are two sides to the question, and I think that most people in the province believe that if you're working in healthcare, you need to be vaccinated in COVID-19, and that's particularly true in long-term care and in assisted living because of the level of risk. I think people who work in healthcare, the vast majority of them know that. And we just want to encourage everybody to get vaccinated. Everybody in healthcare to get vaccinated, everyone in journalism to get vaccinated, everyone in politics to get vaccinated, everyone in construction to get vaccinated, everyone who is a senior and retired in BC, everyone who goes to school who's eligible to be vaccinated over the age of 12. We want everybody to get vaccinated. Because the more people get vaccinated, the less risk there is for them, and the less risk there is for everybody else. And I'll just hand it over to Dr. Henry.
You know, I think it's two sides to a coin in some ways, but from my own discussions with my colleagues in nursing, my colleagues in the ICU, you know, whether it's physicians or nurses or care aides or respiratory therapists, there is this concern, and there are some pockets. There's some long-term care homes where we know rates were not high enough. And we are going out individually to address those issues. I can tell you that from my experience, the rates in most acute care facilities are in the high 90s. We know from Doctors of BC that the rates of immunization in doctors, again, is in the high 90s. We know that it's very high in nursing as well. So it is small groups of people, and yes, it's partly, as I talked about earlier, it is a workplace issue. We want to be doing the best that we can, and we know that we spread this virus to the people that we're closest with, and that includes at work. But we do have other measures. We managed in our healthcare system using PPE, making sure that we were able to identify and test and make sure that people who were not feeling well or had contact stayed away. And that is part of the strain on our system right now. So it is an important measure. We need it to give time for us to have enough vaccine, to have enough a program to make sure that as many people had access as possible, and we needed to accumulate the safety data as well. I do hear, and one of the reasons I brought up pregnancy and breastfeeding is because many healthcare workers are in that childbearing age, as we call it, and it is a very legitimate concern. So we now have some really good safety data, and we have good information about how this virus is affecting people who are pregnant right now and leading to illness. So those are all things that we needed to work out over time, and it is important that every single one of us take that action. You know, I've said this before, as a healthcare worker, it's my obligation both to keep myself well so that I can continue to do the work that I do in the healthcare system, but also to protect my colleagues, to protect my family so that I'm not bringing things home, and to protect the patients that we serve.
Thank you. That's all the time we have for today.